How can we identify the early signs of hair fall?
So basically, hair fall is a kind of a symptom of a disease. Any kind of like kidney condition that can also cause hair loss, thyroid again like stress-induced hair loss, any kind of a systemic problem that can cause the kind of hair loss.
There's also a lot of buzz about rice water and caffeine serums for hair growth. Do they have any real scientific evidence behind them?
They will not able to give that kind of a growth to our hair. Completely myth that okay, if you are using kind of Korean product, there is going to be effective in our skin. Okay, so keratin, I will say that it's not that much good. And once you have the kind of hair loss up to 30%, 40%, we can't reverse back.
Hello and welcome to India TV. I am Shivangi and you're watching HealthDNA. While hair fall and hair thinning are becoming everyday problems, and on social media you will find a new hack every day, from onion juice to rice water and whatnot. But what is real, what is hype, and what should you actually be doing for your hair? To clear the confusion and tell us what really works, joining us today is Dr. Jangid, Senior Dermatologist and Hair Transplant Surgeon at Skin Cure Clinics, New Delhi. Hello, sir. Welcome to India TV.
Hello there.
So to begin with, I would like you to answer and tell our viewers about how can we identify the early signs of hair fall, because that is a major concern today.
Right. So there are three terms are there. One is called hair fall, second called hair damage, and third called hair loss. Okay, so these three terms are different terms. So hair fall may be like normal, maybe abnormal. Means in general, less than hair fall, like less than 100 hair fall is normal. Okay, so there's not kind of a problem. We can have a kind of less than 100 hair fall. This is normal thing.
Okay, so that's normal.
Yeah, if you have kind of hair loss more than 100, so it means this is kind of pathological part, and we have to take some kind of treatment on that. And because of excessive and abnormal hair fall, we have kind of a hair loss on the scalp. Means we have kind of thinning on this area, and we see that the number of hair is reducing.
But sir, just like you said that the amount of hair that you said that yes, it should be, if it is less than 100 or if it is more than 100, how are we going to count?
Yes. So generally, I'm telling that in general, if we used to see roughly 30-40 hair fall per day, okay, if it's like almost double or more than double, then this can be kind of concern for the patient. They can visit to the doctor. Okay, in general. So yeah, but in general, females, they have kind of more problems because they have kind of a longer hair. Okay, so in fact if the hair loss is around 20-30, still they think that okay, this is kind of a abnormal hair fall. So because of abnormal and excessive hair fall, we have some kind of hair loss on this area. Okay, so this is kind of a pathological part, and established pathological part means we have to take some kind of treatment. See, the thinning that you are asking, thinning is a kind of a part of some kind of disease, and that comes in the male pattern baldness. Okay, sometimes other conditions like thyroid or a diabetes, any kind of chronic condition, that also can cause a thinning of the hair. So basically, hair fall is a kind of a symptom of a disease. Okay. Means we have to treat the disease, what we have behind the symptom. Example, if you have the fever, there is no treatment of fever. We are treating the malaria, we are treating the typhoid. Similarly, the hair fall is a kind of symptom. And what is the causing the excessive hair fall, or what's the cause of the hair loss? We have to treat that.
So sir, are these causes different in men and women?
Yes, there are different causes are there. So in general, we are dividing our hair loss in different ways. Okay, some like permanent hair loss, some kind like a temporary hair loss. Like male pattern and female pattern hair loss, this is kind of a permanent hair loss. So that is because of the hormones, that runs in the genetic part. Okay, other causes of permanent hair loss like some kind of trauma that can cause permanent hair loss, any kind of a scar that can also induce hair loss, and sometimes we have kind of a different diseases of the hair loss that also can cause permanent hair loss. Okay, and I can say temporary hair loss like stress induced, or sometimes we have kind of a deficiency in the body, so that also can induce hair loss. But these are like that can be treated very well. Okay, and almost all the hair can come back in general. Okay. So depending on the need, depending on the cause, we have to treat our hair loss part.
So sir, which medical conditions can lead to hair fall?
Medical condition, like there are different, any kind of a chronic condition, any kind of like kidney condition that can also cause hair loss, thyroid again like stress induced hair loss, any kind of a systemic problem that can cause the kind of hair loss, and that can cause also permanent hair loss. Most of people that they are visiting, like they have kind of thyroid problem for so long time, like 2, 3 years, 4 years, and ultimately what happens that some kind of thinning will be there, and they will have kind of a thinning plus a permanent hair loss both. Okay. Yes.
So sir, moving on, as I said, hair loss is very common, but according to you, what is the most common cause of hair fall, hair thinning and hair shedding nowadays?
So the most common cause I can say permanent hair loss is like male pattern baldness and female pattern baldness. So male pattern baldness means the hormones, they are acting on the hair negatively, and they will cause permanent hair loss. So they are causing two changes in the hair. The first, they can reduce the hair growth. Okay, means Generally our hair, they will grow for 2 to 3 years, but because of the hormones, they will grow only for 6 months, for 6 weeks and for 6 days. Means gradual hair loss will be there, plus there will be kind of a thinning of the hair. Okay, it means the hair will be thick earlier, but slowly, gradually the hair will be thinned out. So this is kind of a hair loss. This is most common cause of the hair loss. In females, there are kind of a extra hair loss, like extra causes of hair loss will be there, like anemia is kind of a chronic condition for the females. Almost 30 to 40% Indian females, they have kind of a anemia, so that additional cause may be there in the females.
But sir, moving on, hair fall is one thing. Premature graying is also being seen, and that too at a very young age. I've seen my own brother. He had grey hair when he was in school, I guess 9th or 10th standard. So can this be prevented? And also one question, can this be reversed? Because people claim that there are many serums and oils and etc. that can prevent and in fact reverse this premature graying. Is it possible?
See, premature graying, we used to call in medical, is called kernitis, and this is kind of a pathological if the hair loss or not hair loss, the graying part is less than 20 years of the age. But if your age is 20 years or 20 year plus, so this is not kind of pathological part, and generally this may be a part of your aging. Okay. See, the exact cause of the kernitis or graying is not known, but it's said that some kind of a protein, some vitamins that can induce the graying of the hair. Okay, so in general, if the age is around 15 years or like less than 20 years, so we have to be like more focused on the diet part rather than any other kind of medications. Okay, and graying reversal is like not that much possible. So generally, if you are taking kind of medication for that, they are just preventing the further graying of your hair. Okay, so I can say reversal is not possible generally.
Okay. Now moving on, if we talk about today's generation, as soon as we feel that we're having severe hair loss, we do not move on, we do not go to the dermatologist. We first go to the solutions to market, and there are several over the counter products. I wanted to ask you, do these products actually help or they damage the hair?
So ideally, once a person is coming to our clinic, then we are making a diagnosis, what are the cause of the hair loss. So this is the first that we have to do. Example, if a kind of hair loss because of the iron deficiency anemia, I'm telling you just a single iron tablet that can cure your hair loss. Okay, so randomly you are taking kind of some medications from the online and you think that they will cure your hair loss. I think this is not a kind of right approach. Okay, the right approach, first you have to visit the doctor and he will examine, he will ask many questions, he will do some kind of basic investigations, and then after he will make a diagnosis. This is the cause of your hair loss, and he will focus on that part only, and definitely you will have kind of a good cure of that condition.
Okay. So moving on, there are other products as well, for example dry shampoo and detox shampoos. They are also very popular now, but what long-term impact do they have on the scalp?
So generally shampoos are there to clean the scalp area, not the hair. Okay, so if you have kind of dirt, we have kind of more and more dandruff, then definitely they can clean. And sometimes we are using the medication that also can leave some kind of remnants of the medication on the scalp. So these kind of shampoos, there are two shampoos are there. One is called like medicated shampoos, second kind of a regular shampoo that you can use it. So the medicated shampoos generally they are having kind of a sulfates. Okay, so like cleansers, they are more like cleanser. They are deeply clean. They can clean the scalp very deeply. Okay, so if you have dandruff and any other condition that can be used, okay, that should be used under supervision of a doctor only. We can use like 2 to 3 days per week.
And what about dry shampoos?
See, dry shampoos again like that can be used, but they don't have that much kind of medical evidence behind that. Okay, so the traditional shampoo they are I think very good in general.
Okay, and there's also a lot of buzz about rice water and caffeine serums for hair growth. Do they have any real scientific evidence behind them?
Yeah, rice water and caffeine both having kind of evidence, but again I'm telling you that they will not able to cause, they will not able to give that kind of a growth to our hair. Okay, again if the hair loss is like male pattern baldness, simply we have to ask this is kind of cause and what is the treatment of that. Okay, if you ask, okay doctor, I have the male pattern baldness, I have the female pattern baldness, does these kind of a medication will work for us or not? Okay, so we can say a particular kind of medication, how they are working on that condition. This is how we have to treat it. Okay, not simply that okay we are using caffeine for hair loss. No, again like what is the cause behind your hair loss? And if the cause is male pattern baldness, then I have to think, I have to search for the studies, okay, that this medication is used or not.
Like rice water, many people claim that Koreans use rice water for glowing skin and for good hair also. So is that actually proven or not?
See, Koreans they have got different kind of genes. Okay, so we should not compare their products in our Indian. Okay, if any product is coming from India, coming from the from Korea to India, they will make some kind of modifications in that. Okay, because their skin is something different. Okay, their lifestyle is different. So I think simply this is kind of a completely myth that okay, if you are using kind of Korean product, there is going to be effective in our skin. Okay, just visit to doctor and just ask, okay, I have this condition. Okay, what kind of medication will be the best for me? Okay, make it very simple. Now because of social media, because of other these things and all, see the people directly, the companies directly approaching to the customer.
Yeah.
Okay, and they don't know the real pathology behind that. People, they don't know that what kind of problem I'm having, but they will keep a kind of a circle in that way that yes, this is a kind of product that you can buy and your problem will be solved. I think this is not a kind of right approach.
Okay, but sir, in the market, onion-based serums, shampoos and oils are also being sold widely. So are they safe and genuinely effective for hair growth?
See, onion juice, they are like effective, especially in the alopecia areata. This is kind of a different kind of hair loss where the hair loss is there because of the immunity, because of autoimmunity, and in this autoimmunity can cause a kind of a temporary hair loss generally on the scalp or other areas. So onion juice is a kind of having a kind of a irritant kinds property.
Okay.
So that irritancy can induce the hair growth.
Acha.
Okay, but again, like onion juice for the male pattern baldness, there is no kind of much evidence, so I will not suggest.
Okay, but there are other, keratin and protein heavy repairing masks. They are also becoming very popular. So are they beneficial or should some people avoid it?
See, again, like any kind of treatment you are doing for the hair, for the strands, and that is causing kind of some kind of a heat, some other kind of changes in the structure of the protein of the hair, they are not good in general. Okay, so keratin, I will say that it's not that much good. Yes, hair botox is quite okay because that is causing some kind of layering of the hair and that will improve the hair texture. Okay, that's okay. That will reduce the frizziness, so that can be used. But in general, random treatment that you are watching on the video, watching or some on the YouTube and all, I think that's not good.
Okay, regarding hair growth, rosemary oil, castor oil, they are said to support hair growth. Do they actually work? And if yes, then what is the correct way to use them? Because people think that generally the castor oil, using it directly on scalp will be beneficial, but is that so or not?
Okay, so they have kind of evidence. Okay, but again, like how much we need it. Example, if you have the kind of a severe hair loss, so can we expect from these medications that they can improve our hair growth? I think no. If I have the male pattern baldness, if I'm depending only on the rosemary, I think will not see any kind of visible changes on the scalp. So ideally they are good if you want to maintain your hair growth, and if kind of severe pathology is there, if severe cause is there behind the hair loss, I think that should be treated accordingly.
Also, so I had one personal question as well. We go through several heating treatments on a daily basis, like using blow dryers, straighteners, curlers. How do they impact our hair health?
Again, like see, we have the kind of this protein structure here. Okay, if you are using something on the hair, after that it will not be kind of protein, it will be kind of fiber for us. Okay, so if you are using, then it's okay, but before using, your hair should be very good in a thick condition. Okay, in hair kind of in a good condition, then only this trauma that can be absorbed by the hair. Otherwise, the hair breakage and frizziness will be there. So you are treating one condition and you are also inducing another problem. I think this is not good.
So on a daily basis, you won't recommend?
Generally not, I think.
Okay. So moving on to the solutions, should people use minoxidil or other hair growth medicines as well?
So minoxidil is kind of medication, is old medication, is available OTC. So in general that can be used, but again, like this is a medication, so ideally should be discussed with the doctor first. So he or she will tell you that what kind of percentage should be used and how to use it, okay, proper way to use it.
People should not directly use it.
Yeah, okay, so every medication is coming with kind of indications,
right,
how to use it, okay, and that should be understood first. And when I can see the result, example, a person is telling doctor, I am using this minoxidil for 2 months, there is no growth. So I think this is not the right time that you are, discussing about the result. So this is kind of premature assessment. Okay, so at least 6 months we have to use it. So everything should be like discussed, should be clear. So it will be easy for us to use the medications.
Yeah. So we should move. We should talk.
Discuss with the doctor earlier, and yes.
And then move on to any such things. But also, how effective is PRP treatment, and who benefits most from it?
So PRP therapy is generally like last 20-25 years is quite popular, and in these days like it's quite like more popular, I can say. So this is a kind of a secondary treatment for the male pattern baldness, for the female pattern baldness. So in general we can use certain medications for the hair loss for the male pattern baldness. But again, if I say that which is the best therapy, okay, that can be used after the medication, then comes the PRP therapy. So this is kind of simple therapy. So we can just use our blood, okay, and growth factors to induce our hair follicle only. So there is no any kind of side effect. People, they have kind of a good effects, and plus I can say once in a month therapy to once in like once in 2 months therapy. So it's easy for them to maintain. So I think this is one of the good therapy. But again, like on which condition we are doing this therapy. So ideally, like we have to discuss with the doctor. Sometimes there's no need of PRP therapy. We can simply manage with a simple medications, and there is no side effect of the medication. Then why not we can use the medications only?
Right. But sir, moving on to hair transplant, a big thing today. When is the right time to go for hair transplant? And because right now there are many misconceptions also in the mind of people. There have been many stories and news that we have heard that when it did not go down well, it ended up fatally. So there are a lot of things about it in our mind. Please if you would clear them. But first of all, beginning with, when is the right time to go for hair transplant?
So who is the ideal candidate for the hair transplant? Means his or her age should be at least 24-25 years. Okay. Second, he should be like, he or she should be fit for the surgery. Means he should not have any kind of a medical condition, any other condition. Okay. And third, he should have kind of a stable hair loss. If a person is asking me, saying me, doctor, I have the hair loss for last 6 months and almost 50% hair gone in last 6 months only, it means he is not right candidate. We have to stabilize the hair loss first, then we can plan. And yes, of course, we can examine the hair. If he is having the hair on the back and this scalp is okay, neat and clean, everything is okay, then we can plan the hair transplant for him.
Okay. And what common mistakes do patients make after getting a hair transplant? Because many times we've heard that the patients did not take care that well and it ended up fatally. So
most of time they are doing the mistakes before doing the hair transplant.
Okay.
So the mistake is there, they are choosing a wrong doctor. So ideally we have to choose a dermatologist and plastic surgeon before, like for the hair transplant, and they have kind of a good experience. And among them, doctors who is doing actively that hair transplant. See, hair transplant is something like a kind of a different sub branch, okay, where the doctor is having a experience on that, okay, and he's having a different team. So that kind of setup should be there for the doctor, and doctor should be involved actively in the hair transplant. Okay, this is the first part. So choose a right doctor at least. So he will have kind of a good, at least in the safe hands. Okay. Second, like I have seen that many people, they are very busy. They are not able to give the time. So at least 5 to 7 days, a good rest is needed after hair transplant. These two things are must.
So you need to take rest after hair transplant. But sir, can changing shampoo stop hair fall? It is also one major concern of people.
It's a completely myth, I think. Okay, so shampoo is only for to clean the scalp area. Okay, not for the hair also. So there is no any kind of medication, okay, that can be delivered via shampoo. Okay, or is a kind of very short contact therapy. So generally shampoo will not cause any kind of hair growth.
Okay, sir, according to you, how should one choose the right hair care products for himself or herself?
So there are different products are there now, okay, and every day we
multiple products,
and every day like we are seeing newer things. So again, I will tell you that first we have to see the age factor. Second, what kind of scalp is. Then again, the third part is hair loss or hair condition, what is there. Okay, so depending on all the things that we have to select. Okay, if a scalp is oily, then definitely we have to make it little bit healthier to reduce the oil production in the scalp. Okay, we can use a kind of a anti-dandruff shampoos like 2 days per week or 3 days per week. But after that, because most of the anti-dandruff shampoos, they are having kind of sulfates. Okay, so we have to use a conditioner after that. And we can use in general, we can use regular shampoos also where the sulfate part is almost nil. Okay, so we should not wait to there on the dirt on the scalp. So that can be used in between. So generally I can say alternate days shampoos can be used. But again, which shampoo and which kind of company can be used, I think that should be discussed with the doctor only first. Okay, every 2 months, 3 months or every 6 months when everything is settled, then you can visit to the doctor. Okay, he will tell you according to the condition and all.
And sir, one more question, like in a week, how many times should we go for a hair wash?
Hair wash. That again depends on the condition. If your skin is very oily, then I can say at least 3 days or 4 days per week should be washed. Okay, otherwise you can, like shampoo I'm telling you, you can use anti-dandruff shampoo twice or thrice in a week. Otherwise we can use 2 days per week if your age is like between 25 to 40 years. Okay, so that will not induce the formation of the dandruff part, or that it can be cleared in early stage. And in between you can use a regular shampoo. Okay, and one more thing is there, most of time people, they are coming, doctor, I'm using regular shampoo, but still you can see the dandruff is there.
Right.
Yes, the dandruff will be there because this is an age-related condition and that will go over the age only. But how to use the shampoo means sulfate shampoo or any kind of a medicated shampoo that is coming with a condition. that we have to use at least for 5 to 7 minutes. We have to keep on the scalp at least for 5 to 7 minutes, then you have to rinse off. So these small things that we can make the changes, okay, and we can keep the scalp healthy, I can say.
Okay, so also hair supplements, do they actually work or is it just marketing?
Why hair supplements are needed?
People get into that trap that in fact social media, that we should go on for this supplement and that. So that's why I'm asking this question.
Right. So before that we have to improve our diet, okay, and then we can do the basic investigations, okay. If any kind of deficiency is there, okay, then we can treat with kind of a hair supplements or any other supplements. Otherwise simply we can improve our diet and we can just.
So diet is the best way.
By that, obviously.
And what would you suggest would be the perfect diet for healthy hair?
So in general, I can say a kind of mix of kind of like legumes, okay, dal. Second, we can use a kind of green leafy vegetables. Third, I can say we have to be like at the fruits part, okay, and nuts should be added, okay. And fifth, I can say any kind of non-veg, we can add like milk or non-veg that can be added. And yes, see, some deficiencies will be there because we are not able to, maintain these things, okay.
Yeah.
So in between, after 6 months, every year, if it's there, we can do basic investigation. Then especially we can focus on that diet, okay. So not much like hair supplements are required, I think.
Avoid junk food, that would be better,
Yes,
I guess.
yes.
Have healthy home cooked food, that's what you're saying. But sir, what new advancements can we expect in hair treatments in the coming future?
Yes. So see, the male pattern baldness is the most common cause of the hair loss. For the females also, female pattern hair loss. So we have kind of different treatments called exosomes, okay. So exosomes are kind of a treatment that can be planned every 3 months to 6 months that can induce the hair growth, okay, like PRP therapy. We have another therapy called GFC therapy, okay. There is also kind of another therapy that is also a kind of modified PRP therapy or advanced PRP therapy. Another therapy is called like Follitrans therapy. It's kind of we can use stem cells to induce the hair growth, okay. And we are like looking for different treatments. There are line of treatments are there, okay. So they are in the early stage and they are like in the experimental stage, and over the time they will come, although we are in touch with them, okay. We know that in next 6 months or 1 year this therapy can come, okay. So we have kind of a line of treatments on that, but it's like too early to comment on that, how much results are there and all. But before that, I'm telling you, hair fall is kind of a more nowadays, okay. That is because of epigenetic factor. Means because of our lifestyle, we are not able to see.
It is not mostly genetic, right?
Genetic part is there, but in genetic another part called epigenetic part is added, okay. So that is also influencing the effect of the genetic part, means the sleep part, the light part and the stress part. These three things are there that can induce directly and indirectly to the hair loss. So before hair loss, you should take a kind of a good, I can say, lifestyle. You have to be improve the lifestyle part, and you should not go for the pathological part that I have the hair loss, please do the treatment. Before that, we can take some kind of precautions. We have kind of we can do some improvements and all in our day-to-day lifestyle.
Yeah.
Yes, and we can prevent the hair loss.
That would work. So sir, what should be a basic everyday hair care routine? How should it look like?
Okay. So generally, again, the scalp we can just wash with like 2 to 3 days per week we can use depending on the need of shampoo. Second, if you're like having a very short hair, then no need for using any kind of oil. Okay, or you can use any kind of non-sticky hair oil that is sufficient for us. If you have kind of a longer hair for the females and all, in that stage they can use kind of some leave-on conditioners are there, okay, or they can use again like non-sticky hair oil, okay. This should be sufficient for us. And you're using more and more, I can say, some treatments like straightening or any other coloring, and then we have to improve the hair root, okay. Since your hairs are very thin, so that's why they're easy to break, easy to damage. So once your hairs are very thick and healthy from the from the root, then these trauma can be absorbed. Okay. So this is how that we can just maintain, and yes, use very minimal hair care products. Okay, what we are just so-called DIY or just looking for.
We should not go for all those DIYs that we look on that we see on social media.
No need for that.
There's no need. But so, are there any tests that we should get done to assess hair health?
Yeah, so the basic investigations that can be done, okay, like some blood investigations we can do, some specific investigations can be done if he is having any kind of a medical problem, and we can visit to the doctor, dermatologist, nearby doctor. They can examine the scalp. So the early stage of the hair loss we don't know actually, okay, so they can examine by the lens and all. They can see any kind of a changes is there, early changes of any kind of disease, so that can be prevented. I'm telling you, like for the male pattern baldness, generally people they are coming to my OPD once they have kind of almost 20 to 30% hair loss.
Oh.
Yes. So it means like
almost too late.
almost like I can say half of. So once we'll have kind of hair loss up to 50%, then we can see the scalp. Before that, they think is okay, hair is thinned out, and once you have the kind of hair loss up to 30%, 40%, we can't reverse back. It can't be reversal.
Right.
So it's difficult for them to maintain. Okay, now they wanted, no doctor, I want the same look what I had at the age of 18 years. Now it's not possible.
No, that's not possible.
So
and
that's
the solution becomes hair transplant at that point.
Yeah. So I think again, like we have to stabilize the hair loss.
Yeah.
So first we have to examine everything is okay, then we can plan. But again, I want to tell that every 6 months, every 1 year, they can visit to the doctor. Okay, they can examine their body, skin, and all. How we are doing the basic investigations. Similarly, for the hair also we can do the basic investigations.
So, sir, 5 things we must avoid for good hair health. What are those?
So again, like the hairs are the kind of mirror of the body. So body should be healthy. So I can say our body should be healthy. So first we have to avoid the alcohol part. Second, we have to avoid the smoking. Avoid any kind of DIYs, I think, okay, because that is causing more and more damage to the hair, okay. And fourth, if any kind of medical condition that you have, okay, you should not avoid it, okay, should be take the treatment in the early stage. And now we are more and more like a gym freak, so should not take any kind of a steroid part or anabolic steroids.
Sir, also people have this question in their mind that do sulfates in shampoo always damage hair? Is it true or not?
So sulfate shampoos are kind of medicated shampoos. Okay, again if you're using under supervision of a doctor, they are not going to damage our hair. Okay, so once or twice in a week can be used.
And does oiling really makes our hair healthy?
Not much in general, because there is no any kind of penetration of that oil that can go inside the skin and will reach up to the hair roots, will make some kind of changes. It's not like that.
Okay, now 2 or 3 very small questions. One hair care myth you wish people would stop believing right now?
Don't use oil that much.
Okay, now if you had to pick good diet or good products, which matters more for hair?
Good diet.
Good diet.
Yes.
And if you had to give only one rule for great hair for life, what would it be?
You should be in touch with a dermatologist.
Okay, well that was all.
Why I'm telling you, yes, this is a kind of I want to kind of convey a good message to our audience. See what happens that we have kind of a male pattern baldness, and almost 30% people they have the hair loss at the age of 30 years.
Yeah.
And 50% people they have that again like up to 45 or 50 years. So this can't be like this can be only prevented. So if you are like using a proper medications on a right time, that can prevent. Okay, so if you are having very good diet, if you have good, I can say, lifestyle, everything is okay, everything is perfect in your life, but if your genes are not good, then still that can cause the hair loss.
Okay, so I get it, we need to be in touch with the dermatologist for that, we need to be in touch with the doctor, and do not go for DIYs on social media. That is the biggest message for today. And thank you, sir, for clearing our all doubts, all the myth versus reality versus facts thing, and I hope our viewers liked it. Did you actually like it or not? Do comment and let us know. And for more such interviews and more information on health related topics, stay tuned with India TV.